Today, we are going to discuss accommodating students with attention deficit hyperactivity disorder, also known as ADHD. Attention deficit hyperactivity disorder is a disorder with significant attention problems. An individual diagnosed usually has chronic and serious inattentiveness, hyperactivity, impulsiveness that is more severe and frequent than their peers. There are three different categories that students may be placed in when they're diagnosed, which is the predominantly inattentive. This looks like a student who is often daydreaming or seems to be daydreaming, is not great at keeping track of their assignments, frequently losing things, but not really showing that like physical movement. The other type is hyperactive impulsive type, which is more of that out of control physical impulsiveness. This might be the student that is blurting out in class frequently, and they tend to act before they think. There is also the combined type, and so that can look like a student that has both of those, more of that physical and impulsive action or characteristics, or as well as that kind of seeming to be distracted and not focused or present. The other aspect of ADHD that is important for educators to consider is that these students may struggle with emotional and social challenges. These are students that do have these impulsive characteristics or kind of distanced behavior, and both of those can present challenges when it comes to making relationships with peers and adults. These students have interventions, and one of the interventions is behavioral. So, professionals around ADHD recommend that structure and rewards are integrated into the behavioral management of these students. They are sometimes students that struggle with executive functioning, and ensuring that as an educator, you're providing that structure, providing rewards for positive behavior and verbal praise when they are able to do the things that you are hoping to see from them. While reprimands and consequences are sometimes used in classroom management, ensuring that they're mild and used less frequently than the rewards and verbal praise, we recognize that these students have ADHD, which is something that maybe their peers don't struggle with. So there are going to be things that they have a harder time to do, and ensuring that we are acknowledging and praising the things that they are doing well rather than focusing on the negative behavior, because we know that that's something that is kind of out of their control and we are there to support them. The environmental demands, we'll talk a little bit more in depth about later, but those are the things that are in around the student that might be able to help them succeed more in the classroom. And so that can be the kind of seating that they're in, the arrangement that they're sitting in, fidgets, that kind of thing that might be able to help those students be a little bit more present and focused in control of their movements in the classroom. Parent education. Parents play an essential role in creating a plan of support and success for our students. And while we know that ADHD is usually hereditary, we also recognize that parents sometimes need that education on ADHD and the strategies that would work best for student behavior. In an ideal situation, creating consistency both in the school setting as well as at home is probably best suited for helping our students succeed. And so, with parents, ensuring that we are showing up, not offering our opinions or judgment, but offering hope and support and tools that they can use that would best manage their students' behavior. Um, there are sometimes cultural situations where families from different backgrounds are not as comfortable being vulnerable about these topics, and that is something to be aware of and to be sensitive to. Your role is really to ensure that you are supporting the student the best you can and having those conversations again in the most non-judgmental ways, being patient with how a parent wants to handle situations. You're there again to be supportive. Medication is one of the more common interventions for ADHD. And what's important in as an educator is that you are there as an educator. You are not there giving that medical advice. And so that decision is between the parents and the physicians if their student will be medicated. However, medication is a common intervention. And so being aware of the kind of medications that are often prescribed, a lot of times it is stimulants that are given to students with ADHD. Um, Another thing that parents navigate when they get their students medicated is finding that proper dosage and finding that consistency of when to take medicine. That can look like different times of day that would work best, and how much. So, as an educator, since you are spending a lot of time with that student during the week, making observations about that student's behavior and how they are interacting in the classroom to offer insight if you're asked on if that dosage seems to be helping or hurting that student. If making notes on if they're overly tired or if they're um, not seeming to be eating at all during lunch. These are things that could be important for the parents and the physicians to note while they're trying to figure out what that correct dosage is for that student. Again, you are here as an extension of the team to support students, but you are not there to give your advice on what medication to put a student on. Academic interventions. This is where you shine as an educator. So while you are not in a position to prescribe medicine, you are there to help with academic support. Students with ADHD can struggle academically. And as a teacher, something that's in your control is how you're helping that student navigate lessons and navigate learning in your classroom. So for giving verbal instructions, it can be helpful if you're emphasizing that essential information, even talking in the language of first, we're putting our names on our paper. Second, we are writing the date. Third, this kind of way, students are able to follow along and be focused and engaged in your instruction. In ELA and math, oftentimes there's long tasks that need to be done. And for these students, it would be beneficial to shorten these tasks and have little mini breaks, whether that looks like movement breaks, or a break where they can just look away from the assignment for a little bit and then return back to complete another shortened task would be more helpful for those students. For students that have the hyperactivity and impulsiveness and they are blurting out during instruction, we again want to find the positive behavior that is being shown in there. So while blurting out can be disruptive in class, what's positive is that they're participating. And so finding a way that we can coach those students through raising their hand or maybe writing it down on a note card so they're not forgetting what they want to say, but that way we don't need to um, we're coaching them through that impulsive act of blurting out and trying to make it a behavior that is better suited for the classroom while still encouraging the fact that they're participating and giving them that positive feedback that is awesome that you want to participate in class. Here's how we're going to do it so that it lends itself to classroom instruction. Students with ADHD also can utilize assistive technology. So when it comes to writing a paper, for instance, if taking the time to type out paragraphs or an essay is difficult for that student, they could possibly use the talk to text feature. And that can be an opportunity for students to still get out their thoughts and participate in an assignment, but do so through assistive technology. These students sometimes struggle with executive functioning, and so creating any type of organizers, um, definitely for an essay, if there's organizers, graphic organizers that you can provide that would be helpful for them, that's another way that as an educator, you can provide interventions academically that support their success. Oftentimes these students have IEPs and or 504 plans. And so in those plans, that is where students can have extra time on tests, instruction that is tailored to them specifically, positive reinforcement and feedback, that assistive technology, breaks, movement breaks, a change in their environment. If you can have that adult support and be able to have a student go walk out to the water fountain and come back, any way that we can help these students return to the classroom more focused, those plans are put in place so that we can create a plan for them that works. An aspect of this is also environmental supports. And so this is a moment to think about how your classroom is arranged, and thinking about what would be best suited for those students. So desk setup is another aspect of that. If a student would work better if they had a privacy folder so that they could focus on their work, that's something that you can offer them. For our more inattentive students that maybe need more discrete cues and prompts to follow along in the lesson, having them seated in an area that would be closer to you would be helpful, because again, we don't want to show up to these students and be sarcastic and be critical, and also publicly humiliate them. They have ADHD. We're here to support them and coach them. Having those accommodations are a way that you're able to do so, discreetly and professionally and kindly, while also supporting that student. Classroom rules and routines can also be a way that you are accommodating these students. How does your classroom flow, and how do you have management styles that would be inclusive of these students? Integrating activities that are more hands-on and encourage more student participation is another way that you can be creative and inclusive. Organizational training, again, these students can really benefit from having this additional coaching on executive functions. Recognizing that these students have ADHD, which means that they have different ways and abilities that are differing from their peers, coming at that with not frustration, but just an opportunity to continue building that relationship with that student and see what fits best for them. Families with children with ADHD, they may face additional challenges compared to other families. Having a student that's struggling with ADHD and maybe more impulsive behaviors, we have to recognize as an educator that we are there as part of the support team for these students, and we want to show up with these to these families with patience, kindness, compassion, empathy, as they're navigating what's best for their children. So it is not always the case that the first accommodation or intervention that you try with students is the best fit. And so having that patience and ability to recognize that the families are being vulnerable if they're asking for help and support, you're there as an educator to be part of that team and really try to figure out what would best support the students. So again, coming to accommodations with accommodating students with ADHD with more of a reflective perspective on how is this student entering my classroom and how can I make sure that they feel included and they feel engaged in class is really important, as well as approaching these families with that cultural sensitivity and non-judgmental input. So here are my few references on this presentation. And again, I just want to recognize how important it is that we're welcoming these students in. We want them to be in our classrooms. We want them to feel like they're being cheered on and that they are supported. So it's really important that as educators, we're able to reflect on how we can best include students and create our instruction, our classroom routines, our management styles in a way that is positive and supportive.